CEN exam prep exam questions. Question 1. A patient with a history of alcohol use disorder presents with confusion, ataxia, and ophthalmoplegia. What is the most likely diagnosis? Option A. Wernicke-Korsakoff syndrome. Option B. Delirium tremens. Option C. Alcoholic ketoacidosis. Option D. Hepatic encephalopathy. The correct answer is option A. Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome presents with the triad of confusion, ataxia, and ophthalmoplegia, caused by thiamine deficiency due to chronic alcohol use. Delirium tremens, B, presents with tremor, agitation, and hallucinations. Alcoholic ketoacidosis, C, presents with metabolic acidosis. Hepatic encephalopathy, D, presents with altered mental status due to liver failure. Question 2. A patient with a history of DVT presents with sudden onset of chest pain and dyspnea. What is the priority nursing action? Option A. Administer oxygen. Option B. Obtain a 12-lead ECG. Option C. Prepare for CT angiography. Option D. Administer heparin. The correct answer is option A. Administer oxygen. The ABCs are the priority. Administering oxygen to treat hypoxemia is the first step. ECG, B, is used to rule out ME but is secondary. CT angiography, C, is diagnostic but not the priority. Heparin, D, is treatment but follows oxygen and diagnosis. Question 3. A patient presents with a chief complaint of suicidal ideation. Which of the following questions would be a priority for the nurse to ask? Option A. Do you have a plan? Option B. What medications do you take? Option C. Do you live alone? Option D. Have you attempted suicide before? The correct answer is option A. Do you have a plan? When assessing a patient with suicidal ideation, determining if they have a specific plan, means, and intent is the priority. This directly addresses the patient's immediate risk. Other questions, B, C, D, are relevant for history but do not assess imminent risk as directly. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient presents with a temperature of 101.4 degrees Fahrenheit, heart rate of 110 beats/min, and respiratory rate of 26 breaths/min. To consider if the patient may have sepsis, the nurse should assess if the patient has Option A. A possible infection. Option B. Positive blood cultures. Option C. An immunocompromised state. Option D. Been febrile over 24 hours. The correct answer is option A. A possible infection. According to the current definition of sepsis, a patient with signs of infection, fever, tachycardia, tachypnea, should be assessed for a possible source of infection. Sepsis is defined as life-threatening organ dysfunction caused by a dysregulated host response to infection. Positive blood cultures, B, are not required for diagnosis. Immunocompromised state, C, is a risk factor. Duration of fever, D, is less relevant. Question 5. A patient with severe asthma exacerbation has a peak expiratory flow rate, PEFR, of 35% of personal best. Which treatment should the nurse anticipate? Option A. Continuous nebulized albuterol. Option B. Oral corticosteroids. Option C. 4-magnesium sulfate. Option D. Immediate intubation. The correct answer is option A. Continuous nebulized albuterol. PEFR below 50% indicates a severe exacerbation requiring aggressive bronchodilation. Continuous nebulized albuterol is indicated for severe asthma. Oral corticosteroids, B, should also be given but are not the immediate treatment. 4-magnesium, C, may be used for refractory cases. Intubation, D, is for impending respiratory failure with altered mental status, exhaustion, or hypercapnia. Question 6. A patient with Crohn's disease is at increased risk for which complication? Option A. Toxic megacolon. Option B. Intestinal obstruction. Option C. Perforation. Option D. Fistula formation. The correct answer is option D, fistula formation. Crohn's disease is a transmural inflammatory process that often leads to fistula formation between bowel loops, skin, or other organs. Toxic megacolon, A, and perforation, C, are more common in ulcerative colitis. Intestinal obstruction, B, can occur in both, but fistula is more specific to Crohn's. Question 7. A patient with a dog bite to the hand presents 48 hours later with redness, swelling, and purulent discharge. What is the most likely causative organism? Option A, Staphylococcus aureus. Option B, Pasteurella multocida. Option C, Streptococcus pyogenes. Option D, Bichnella corrodens. The correct answer is option B, Pasteurella multocida. Pasteurella multocida is the most common organism isolated from dog and cat bite wounds. It typically causes infection that appears within 24–48 hours with purulent drainage. Staphylococcus aureus, A, and Streptococcus pyogenes, C, are also common but less specific to animal bites. Bichnella corrodens, D, is associated with human bites. Question 8. An epidural hematoma is most commonly associated with which mechanism of injury? Option A, striking the head on a hard surface. Option B, rapid deceleration injury. Option C, injury to the temporal bone with laceration of the middle meningeal artery. Option D, acceleration minus deceleration injury causing shearing forces. The correct answer is option C, injury to the temporal bone with laceration of the middle meningeal artery. Epidural hematoma is typically caused by a blow to the temporal area of the skull, lacerating the middle meningeal artery. This results in rapid accumulation of arterial blood. Option A is too general. Option B describes diffuse axonal injury. Option D describes subdural hematoma. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient with increased intracranial pressure is at risk for Cushing's triad. Which of the following comprises Cushing's triad? Option A, hypertension, bradycardia, irregular respirations. Option B, hypotension, tachycardia, tachypnea. Option C, hypertension, tachycardia, Shane-Stokes respirations. Option D, hypotension, bradycardia, hypoventilation. The correct answer is option A, hypertension, bradycardia, irregular respirations. Cushing's triad is a late sign of increased ICP, indicating herniation is imminent. It consists of hypertension, widening pulse pressure, bradycardia, and irregular respirations. This compensatory response is the body's attempt to maintain cerebral perfusion. Question 10. A patient presents with coffee minus ground emesis and melena. What is the priority nursing action? Option A, administer 4 fluids. Option B, insert a nasogastric tube. Option C, prepare for blood transfusion. Option D, assess airway and breathing. The correct answer is option D, assess airway and breathing. The ABCs take priority. Coffee minus ground emesis and melena indicate an upper GI bleed. The patient is at risk for aspiration and hypovolemic shock. Airway assessment and breathing are the first steps. 4 fluids, A, blood transfusion, C, and ing tube insertion, B, are important but secondary to airway assessment. Question 11. A patient who has ingested a large amount of acetaminophen is at risk for? Option A, acute kidney injury. Option B, hepatic necrosis. Option C, pulmonary fibrosis. Option D, cardiomyopathy. The correct answer is option B, hepatic necrosis. Acetaminophen toxicity causes hepatic necrosis due to accumulation of the toxic metabolite NAPCI, which depletes glutathione and damages hepatocytes. Acute kidney injury, A, can also occur but is secondary. Pulmonary fibrosis, C, and cardiomyopathy, D, are not associated with acetaminophen toxicity. Question 12. The nurse is caring for a patient who has been diagnosed with an advanced end-stage cancer. The medical team has suggested palliative care and hospice. Which of the following statements would be appropriate for the nurse to make when explaining the suggestion to the patient's family? Option A. Palliative care begins with the initial diagnosis and continues through the end of life. Option B. The patient cannot change their end-of-life decisions once enrolled in hospice. Option C. There is an important legal distinction between withholding care and withdrawing care. Option D. A living will names a person to make medical decisions if the patient is unable to do so. The correct answer is option A. Palliative care begins with the initial diagnosis and continues through the end of life. Palliative care is appropriate at any stage of a serious illness, starting at diagnosis, and can be provided alongside curative treatment. It is not limited to end of life. Hospice is one type of palliative care for end of life. Patients can leave hospice at any time. B. Withholding and withdrawing care, C, are not what is being explained. A living will, D, is a legal document specifying treatment wishes, while a healthcare proxy names a decision-maker. Question 13. The possibility of an ectopic pregnancy increases when a patient has a history of Option A, breast cancer. Option B, endometriosis. Option C, teenage pregnancy. Option D, pelvic inflammatory disease. The correct answer is option D. Pelvic inflammatory disease. Pelvic inflammatory disease, PID, can cause scarring and damage to the fallopian tubes, increasing the risk of ectopic pregnancy. Endometriosis, B, can increase risk, but PID is the most significant risk factor of these options. Breast cancer, A, and teenage pregnancy, C, are not risk factors. Question 14. A patient with a known history of type 1 diabetes presents with nausea, vomiting, and a blood glucose of 450 mg/dl. ABG shows pH 7.15, HCO 312 milliequivalent/L. What is the priority intervention? Option A, administer regular insulin 4. Option B, administer 4 fluids. Option C, administer potassium. Option D, obtain a urine ketone test. The correct answer is option B, administer 4 fluids. In DKA, fluid resuscitation is the first priority to correct dehydration and improve perfusion. Insulin, A, is given after fluids. Potassium, C, is given after the patient is rehydrated and potassium is monitored. Urine ketones, D, are important but not the priority. Question 15. A patient with suspected renal colic has a temperature of 101 degrees Fahrenheit. What is the priority nursing action? Option A, administer 4 pain medication. Option B, obtain a urine sample. Option C, notify the provider immediately. Option D, administer antiemetics. The correct answer is option C, notify the provider immediately. Fever in a patient with renal colic suggests a superimposed infection, which can rapidly progress to urosepsis. The provider should be notified immediately so antibiotics can be initiated. While pain medication, A, is important, the infection needs to be treated promptly to prevent sepsis. Question 16. A patient is brought in after a sexual assault. Which of the following nursing actions is most appropriate when discussing the forensic exam? Option A, explain the importance of the exam and offer to have a sexual assault nurse examiner, CEN, perform the exam. Option B, tell the patient they must undergo the exam to report the assault. Option C, perform the exam yourself to minimize the number of people involved. Option D, delay the exam until law enforcement is present. The correct answer is option A. Explain the importance of the exam and offer to have a sexual assault nurse examiner, CEN, perform the exam. Patients who have been sexually assaulted should be informed about the forensic exam, offered the option of having a CEN nurse, specialized in sexual assault care, and given the choice to proceed. The exam should never be forced, B, and a CEN nurse should perform the exam if available, C. Law enforcement involvement, D, is the patient's choice. Question 17. A patient presents with acute onset of severe, tearing chest pain radiating to the back. Blood pressure is 160/90 mmHg in the right arm and 110/70 mmHg in the left arm. What is the priority nursing intervention? Option A, administer 4 morphine for pain. Option B. Obtain a 12-lead ECG. Option C. Administer 4 beta- blockers to reduce heart rate and blood pressure. Option D. Prepare for stat CT angiography. The correct answer is option C. Administer 4 beta- blockers to reduce heart rate and blood pressure. This patient's presentation, tearing chest pain radiating to the back with unequal blood pressures, is classic for acute aortic dissection. The priority medical intervention is rapid reduction of heart rate and blood pressure to decrease aortic wall stress and prevent propagation of the dissection. Beta- blockers, example esmolol, are the first line agents. While pain management, A, is important, it is secondary to hemodynamic control. ECG, B, is appropriate but does not address the life-threatening process. CT angiography, D, is diagnostic but is performed after stabilization. Question 18. A patient presents to the emergency department reporting slurred speech and an unsteady gait for about 6 hours with complete resolution of the symptoms. Which of the following statements by the patient would be a priority to follow up? Option A. I haven't been able to refill my blood pressure medication for a few weeks. Option B. I use cannabidiol, CBD, edibles to help me sleep. Option C. I was diagnosed with Guillain-Barré syndrome as a child. Option D. My grandmother had rheumatic heart disease. The correct answer is option A. I haven't been able to refill my blood pressure medication for a few weeks. This patient's symptoms describe a transient ischemic attack, TIA. Uncontrolled hypertension is a major risk factor for future stroke and requires immediate intervention. While CBD use, B, may be important, it is not as critical as uncontrolled hypertension for TIA management. Guillain-Barré, C, can cause similar symptoms but is not the priority. Family history of rheumatic heart disease, D, is less relevant.
Stressed about your Colorado real estate? We can take Colorado real estate for you remotely and undetected. We always guarantee A-Pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 19. A patient with opioid use disorder presents with suspected opioid overdose. Which medication should the nurse anticipate administering? Option A, naloxone. Option B, flumazenol. Option C, naltrexone. Option D, methadone. The correct answer is option A, naloxone. Naloxone, Narcan, is a pure opioid antagonist that reverses the respiratory depression and sedation of opioid overdose. Flumazenol, B, is for benzodiazepine reversal. Naltrexone, C, is for maintenance therapy. Methadone, D, is a long-acting opioid. Question 20. During a disaster drill, which patient should be prioritized for evacuation? Option A, patient with a fractured femur who is stable. Option B, patient on a ventilator. Option C, patient with a minor head laceration. Option D, patient with a sprained ankle. The correct answer is option B, patient on a ventilator. In a disaster evacuation, patients who are ventilator-dependent are the highest priority due to their reliance on life-sustaining equipment and difficulty in moving them. Stable fracture patients, A, and minor injuries, C, D, can wait. Question 21. A patient with heart failure presents with acute pulmonary edema. The nurse anticipates which initial medication? Option A, for furosemide. Option B, for morphine sulfate. Option C, for nitroglycerin. Option D, for dobutamine. The correct answer is option C, for nitroglycerin. For acute pulmonary edema, for nitroglycerin is often the first line medication as it causes venous and arterial vasodilation, reducing preload and afterload, and quickly relieving symptoms. Furosemide, A, is used for diuresis but takes longer to work. Morphine, B, is used cautiously and is not typically first line. Dobutamine, D, is for cardiogenic shock with low cardiac output. Question 22. A patient in atrial fibrillation with rapid ventricular response has a heart rate of 152 bpm and is hypotensive. Which intervention should the nurse anticipate? Option A, administration of 4-diltiazem. Option B, administration of 4-amiodarone. Option C, synchronized cardioversion. Option D. The administration of 4-digoxin. The correct answer is option C. Synchronized cardioversion. In unstable atrial fibrillation with rapid ventricular response causing hypotension, synchronized cardioversion is the immediate treatment of choice. Hemodynamic instability indicates the patient cannot tolerate the rapid rate and requires immediate electrical conversion. Chemical rate control with diltiazem, A, amiodarone, B, or digoxin, D, is appropriate for stable patients but is too slow for unstable patients. Question 23. A patient sustains a deep laceration to the palm of the hand. Which assessment finding suggests median nerve injury? Option A. Inability to abduct the fingers. Option B. Inability to oppose the thumb. Option C. Inability to adduct the thumb. Option D. Decreased sensation in the small finger. The correct answer is option B. Inability to oppose the thumb. The median nerve innervates the thenar muscles, including the opponens pollicis, which allows thumb opposition. Injury to the median nerve will cause inability to oppose the thumb. Finger abduction, A, is controlled by the ulnar nerve. Thumb adduction, C, is controlled by the ulnar nerve. Sensation in the small finger, D, is controlled by the ulnar nerve. Question 24. A patient presents with alcohol intoxication. Which assessment finding is most concerning? Option A. Slurred speech. Option B. Gait instability. Option C. Nystagmus. Option D. Decreased level of consciousness. The correct answer is option D. Decreased level of consciousness. Decreased level of consciousness is the most concerning finding in alcohol intoxication as it may indicate severe intoxication, hypoglycemia, head trauma, or other co-minus ingestions. Slurred speech, A, gait instability, B, and nystagmus, C, are expected signs of intoxication. Question 25. A patient presents with the following symptoms: butterfly rash on the face, joint pain, and photosensitivity. What is the most likely diagnosis? Option A. Systemic lupus erythematosus. Option B. Rheumatoid arthritis. Option C. Scleroderma. Option D. Sjogren's syndrome. The correct answer is option A. Systemic lupus erythematosus. Systemic lupus erythematosus, SLE, commonly presents with the classic butterfly, malar, rash across the cheeks and nose, joint pain, photosensitivity, and other systemic symptoms. Rheumatoid arthritis, B, presents with joint deformity and morning stiffness. Scleroderma, C, presents with skin thickening. Sjogren's syndrome, D, presents with dry eyes and dry mouth.